Patients that we see that come into our practice really want to look refreshed and they want to look totally natural and they don't want anyone to know that they've had any work done. The individual surgeon's ability to accomplish that is really related not just to the technique the surgeon uses for the facelift, but it's also related to the artistic eye of the surgeon, their own ability, their own assessment of aesthetics. So it's very important for you to find those doctors that you're very comfortable with in terms of their natural outcomes, if that's what you're looking for. Because when people say things like, I've never seen a good facelift, my answer is that's the whole point. The downtime for a facelift can range considerably based on individual features. The extent of the facelift, the amount of intraoperative trauma or bleeding, which in most cases is very little, your own ability to heal and how you heal. Some people heal slowly, some people swell a lot, some bruise a lot. But in general, most patients who have facelifts are feeling very much back into social acceptability by 2 to 4 weeks. I have patients that go out to dinner the second night after a facelift, and I have patients that take even up to 4 months to really feel that things are kind of back to looking normal. But in general, the vast majority of patients having facelifts are healed and look good and are socially back to their normal habits within about 2 to 4 weeks. Facelifts are not just for older people. Facelifts are really for people who show extra skin or laxity in the jowl area and in the neck. In those situations, facelifts may be an ideal approach. Sometimes the facelifts can be a very simple mini facelift that requires very little downtime, is a very safe and quick little procedure, and other times, especially when the neck is involved and there are lots of contour abnormalities, the face and neck lift can be much more complex. We have patients in our practice that are in their early 40s and already are seeking mini facelifts because of laxity. This is a genetic issue. You can't necessarily control the tissue that you are born with and how it responds to the environment and how you age. But if the physical findings are such that you would benefit from a mini facelift, even if you're at a younger age, then this is a procedure you might want to consider. A facelift lifts and to some extent fills the face. The mechanism of aging in the central part of the face is a loss of fat and some descent of some of the fat pads. So when a facelift is done with a deep plane, you're repositioning these fat pads to some extent. However, in the central face, a lot of the fat loss is really atrophy of the fat itself. And so in many cases, we prefer to combine basically restoration of your fat pockets with repositioning of your tissues, which is accomplished by fat grafting and a facelift. Facelift results generally last anywhere from 7 to 12 years. It really depends somewhat on the technique and also on the patient's condition. For instance, if patients come in with severe laxity and severe sun-damaged skin, that tissue is not going to respond quite as well to longer-term results as somebody who comes in with healthier skin and lesser degrees of laxity per se. But in general, when we do deep plane facelifts, these tend to last somewhere between 7 to 12 years. And again, remember, lasting in aesthetic surgery is a very personalized thing. There are patients who begin to go like this 2 minutes after they have a lift, and there are other patients that come in after 15 years and really don't want to do anything further, even though the physical appearance has changed and gone back to their preoperative state.